Hi, I'm Dr. DeFabio, and it's a great day to talk nutrition and wellness. This series is about CBD, cannabinoids, and the benefits they have for us, as well as how they interact on the body. CBD, cannabinoid, comes from hemp, it comes from marijuana, but why do people take it from hemp and non-THC derived CBD, meaning no psychoactive effects, is for several reasons. Pain and inflammation are the top two reasons. The inflammation can be anywhere. It could be in your stomach, in your gut. It could be in your joints. It could be in your muscles. Hey, it could be in your brain. All of those inflammatory reactions can be decreased with CBD, those CBD2 receptors, which don't act on your brain. They're very safe. In fact, they have no THC or very minimal THC in them. Will it work on anxiety? Will it work on stress disorders? Will it help people relax better? Yes. It also works on those things as well. A lot of times it is related to the inflammatory state. CBD is mostly found in hemp. It's also found in black pepper. It's also found in cacao. It's also found in kava. So there are other natural sources of it. Our body makes it too, but it only makes it on demand and it gets used up rapidly. It doesn't store it at all. That's why the benefits of CBD are so expansive and the use is also so wide. Just to let you know, we are going to be doing some lectures in the office, September 25th and on the 24th even. One's going to be at 6:45 at night for the people who work all day. One's going to be at 1:45 in the afternoon for the people who need to be home for their families after 3 o'clock. They're going to talk about the indications of CBD, how it works, how to pick a good product, and everything you need to know to implement it on your own. So there you go, mark that on your calendars. We're going to be sending out more posts and we're going to be making events, so keep your eyes open. That's it. That's what it's all about. CBD and you. This is the deal. I'm Dr. DeFabio. Thanks for tuning in.